What's up, guys? This is Dr. Joe Riskowski with IDPT, and today what we're going to be talking about is what is tennis elbow, why, if you're watching this video, you still have it months later, and then what can be done about it. So stay around. This is going to be a great episode. All right, guys, to be able to fix tennis elbow, first we need to understand what it is. So tennis elbow is also called lateral epicondylitis, and it's an inflammation of the extensors of the forearm. Now, like I said, if you're watching this video and you've probably had this issue for upward of 6, 12 months, and you can't understand why it won't go away. The reason is because most people only treat the site of the pain. So they're only treating their elbow. And when this happens, yes, we can bring down some inflammation. We might be able to temporarily reduce the pain, but ultimately we're never going to fully get rid of it because we don't address why it's happening in the first place. And for us to get to that underlying root cause, we need to understand that tennis elbow is a shoulder issue, it's an elbow issue, and it's a wrist issue. Because what's happening is all the stress and inflammation is developing in the elbow, but that's just the victim. The real culprit of this is the ability of how the wrist and how the shoulder are moving and absorbing and producing forces. So when we bend our elbow, our whole entire forearm actually supinates. And supination is when your pinky basically comes closer towards your face. And when we fully straighten our elbow, we pronate. And so your thumb is turning down and we're getting more rotation at the elbow. Why that matters is because supination is associated with external rotation throughout the whole body, and pronation is associated with internal rotation throughout the whole body. If we don't have or we lose external or internal rotation in our shoulder, then our elbow is going to have to pick up the slack. So in regards to tennis elbow in particular, what happens is we get stuck in a position of elbow pronation, and we get stuck in a position of wrist extension because you can see that turn on my forearm extensors. So if we're stuck in that position, the muscles are always going to be turned on and tight, and hence there's no amount of like exercises or manual therapy like massages that can permanently bring down this inflammation. Think of it like this. If your elbow was stuck like this and you were always in a bicep curl, it wouldn't matter if I massage your bicep and give you some other exercises to offset that, because ultimately when you go back home, your elbow is stuck like this, so your bicep is going to be tight. Well, the same thing is happening at your forearm. You're stuck in a position that these muscles are turned on. So just to summarize, if you're missing either external or internal rotation at the shoulder, our elbow has to compensate with either excessive supination or pronation. In the case of tennis elbow, you're likely stuck with excessive pronation and with wrist extension compensating for the shoulder. So when rehabbing this issue, then we need to address the missing rotations at the shoulder. And to do that, we actually need to take it back another layer and start addressing the shoulder blade and the rib cage. The reason is because the shoulder blade is the socket of the shoulder, which lays on top of the rib cage. So if our foundation of our house, aka our rib cage, is off, then that's going to affect everything else. So the order of compensation in which we need to treat is the rib cage, the shoulder blade, the shoulder, the elbow, and the wrist. So what I'm going to do is show you one exercise for each body part that you can implement right now every single day to finally get rid of the inflammation and all the tension and pain in your elbow that you've been dealing with for months. All right, so the first thing that we're going to do is mobilize the rib cage. Oftentimes with tennis elbow, what happens is we lose the shoulder mobility because the rib cage is too wide and can't have the ability to close down. So what we're going to do is we're going to take a full-size towel, and then I want you to roll it really tight so that it's still kind of hard. From there, you're going to place it right on the bottom of your rib cage, okay? And you're going to lie on your side with your knees together. Use your down arm as a pillow for your head. From here, you're going to take a deep, soft breath in through your nose, and what you're going to feel is your rib cage wants to expand, but this towel is going to block it, okay? So you're going to breathe in through your nose and then take a long breath out through your mouth. And when you breathe out through your mouth, I want you to further feel your rib cage close down. You're going to do 6 breaths twice and then flip sides. We're going to do both sides. All right, next I want to alleviate tension around the shoulder blade area. So what you're going to do is you're going to tie a band to a pole or a door, okay? And then you're going to put your wrist into the band and then grab the band. Okay, I don't want any tension here. You're simply just holding onto the band. From here, you're gonna step back so that there's tension on it. And then from here, let this arm just get pulled. And you're just gonna hold that for 30 seconds. And you should feel a really nice big pull all the way up to like your upper trap area. So again, just stepping back, let that stretch you out. Go 3 times, 30 seconds on the affected side. All right, next you're gonna tie a band to a fence or a door or something, and then you're gonna leave it there and never do this exercise again, because this is not going to fix your issue. The reason that it doesn't help is because you're trying to basically force your shoulder into a position instead of create space in the socket that now we have more mobility and more room to move into. So here's an exercise that's gonna give us rotation back in our shoulder without forcing it into a position. So what we're gonna do instead is an open hand kettlebell screwdriver. What we're gonna do is lay on our side with our knees together again and grab a light kettlebell. I know this is big, but it's pretty much empty inside. It's really light, okay? So on the affected arm, you're gonna grab this kettlebell and have the bell behind your wrist. From here, you're gonna punch straight up so that your hand, your elbow, and your shoulder are all in a straight line. Okay, now this sequence matters because we talked about the rotations. When you turn your palm towards your face, I want you to look at it and breathe in through your nose. And then when you turn away, I want you to look away and breathe out. And the whole time we're keeping our arm in a line with the side of our body. So look at it, breathe in, turn away and breathe out. And you'll notice my hand is open. The reason is because that extensor muscle of the forearm is responsible for gripping. So right now we're trying to let that muscle calm down. So I'm not gonna make you squeeze this kettlebell. We're gonna keep it open. So breathe in here, look away, breathe out. I want you to do 8 to 12 reps. Each direction is 1 rep. 8 to 12 reps, 2 to 3 times. All right, so now it's time to get to the elbow. So first, we're gonna start with a lacrosse ball, but at home if you have a tennis ball, sore subject, a baseball, or anything hard that can dig into that area, you can use that. So I'm just gonna put it here, and then to tolerance, I'm gonna work right in the meat of this elbow. I'm gonna work down right in there, and then I'm gonna move all the way to my wrist, because this whole muscle runs up and down the forearm. So we wanna hit all of it. Typically what I recommend is doing this for about a minute. I don't wanna overdo it, so there's no reason to be digging on this for 5-10 minutes, but it's definitely gonna help just relieve some tension. A bonus is actually working on the hand because it's related to the wrist. So you can actually take the lacrosse ball into the pad of your thumb and roll that out as well. And you're gonna feel it's gonna be tender in there. Because of the rotations, it's gonna make that area tight. So same thing, about 30 seconds in there. Now, in addition to the lacrosse ball for the elbow, we're gonna do something called a concentration curl, and we're gonna have the same rotations involved that we just had for the shoulder. So what you're gonna do is you're gonna grab like a medium kettlebell. So for a curl for me, I have 15 pounds, and the outside of your elbow is gonna rest on the inside of your thigh. From here, when you curl up, your palm is gonna be facing you and you're gonna look at it just like we did with the shoulder. And when you straighten your elbow, I want you to turn your palm away from your face. So again, you're gonna curl up and turn that palm towards you, curl away and turn away. I wanna go for really as many as I can. Typically I prescribe these at 12 to 15 reps. You shouldn't feel any pain or tension in that tennis elbow area. So if you do, discontinue this and go back to the other ones first. Finally, we want to address the wrist. So with tennis elbow, the wrist is relatively stuck in the extended position. So a really simple stretch is by doing the opposites. A common stretch that most people do, it's actually the wrong thing though, is they pull their fingers up to the ceiling and pull back because they feel this muscle turn on. But if you remember what I said earlier, tennis elbow happens from a place of a wrist that is relatively stuck in extension. So the last thing that I want to do is further pull it into extension, even though I feel that what I feel is muscle tension, not a stretch. Instead, I want to stretch it a different way. So you're going to go palms facing down, take your other hand and pull that palm towards you. Make sure your elbow is straight while you're doing this, and you're going to feel a really nice pull right through here. All right, guys, so just to summarize, if you have tennis elbow, you likely have a limitation in the way that your shoulder moves. And if that's the case, then it must be true that you have a rib cage that is too rigid and not moving the way that it needs to. So with that, I want you to go through these exercises that you learned today, continuously stay up on them, and ultimately your elbow should be feeling a whole lot better. So if that's the case, I want you to like, share, and subscribe to this channel, and I'll see you at the next episode.